I'm a physician. I've been a physician for a long time, over 20 years, and I spend a lot of time in community. And some of the things I hear from people are related to how they don't trust us in healthcare. We overprescribe, at least that's their perspective, and that we speak in a language people don't understand. In addition to not speaking the language people need to hear, we need to tailor our messages so that people understand how to engage in healthcare, feel comfortable asking questions, feel comfortable engaging in care. And I think that is overlooked. I think health literacy is an undervalued and under-recognized driver of cost, outcomes, patient satisfaction. It is very instructive to go into a community and talk to people and understand why medication adherence is low. Why is the no-show rate so high? Why are people using the emergency department instead of going to a primary care doctor? And once you have that information, acting on it. I think that's a huge problem across the health sector. This is a really important issue, and I'm glad you're raising it. So the way we communicate often in research, in healthcare, anything scientific, we tend to create messages that are for us. It's a very insular conversation. We talk to each other, we're familiar with scientific and medical terms, and we become so accustomed to speaking in this manner that when we're talking to the public, we think they know what we're talking about, but we have lost them. Well, I think it's pretty obvious. We often overlook the obvious because it can't be that simple, can it? Where are people getting health information? Forget about health information. Where are people getting information, period? And we've asked lots of people this question as well. They're getting it from social media. They're getting it through the grapevine, from friends and family, from people who in their family or in their sphere of influence who've maybe been in the hospital. And I had a woman tell me, well, we go to my uncle when we have a question because he spent almost 2 months in the hospital and he knows almost everything about healthcare. So he is the person they call when they have a question. They don't call a doctor.